my next question is for the people that are watching the audience that are like, yeah, I have that, or I've dealt with that, or my hip alignment is off. And they're like, so I want to get this fixed, doc. Where do I go? Because I don't live in Texas.
Yeah.
What do you say to those, potential patients?
Well, there are some great places that they can go, probably around them. But for the upper cervical work, unfortunately, at this point in time, we're all kind of a small group. There's over 130,000 licensed chiropractors in North America and Canada, and there's only about 1,200 of us that practice this specialty. So it is pretty much a specialty. And really, I think right now, there's less than 100 of us that are diplomates in this area in the whole world. So
Wow.
we are going to Europe. We just went to Europe, the Netherlands, to kind of show this information to, across the pond there. But we're trying to get more people in our program, more docs in our program, so we can start graduating more of these diplomates as well, and start getting people like the technique that I do is called orthospinology. You can go to orthospinology.org, and you can put in your zip code, and you can find a doctor that's in your area. You can look at their credentials. You can go to their website, everything. So that is the technique that I do. If for some reason that my technique, the orthospinology.org, is not in your area, then you can go to uppercervicalcare.com, and you can, again, do the same thing, put your zip code in there and find somebody close to you. So those are the two ways that you can look up somebody in your area.
So for the person in the audience that's watching right now, doc, and it's like, well, I don't have sciatic issues. I'm young. I don't have, hip alignment issues. I feel fairly healthy. Is this something I need to look into? What would you say to the person that still feels young and healthy?
Well, feeling young and healthy is always a great thing. I mean, we are kind of like Superman and Superwoman and Gumby, when we're younger. However, I like to consider subluxation, which is the misalignment of the spine. I like to consider subluxations as more of a cavity in your tooth. Now, many of your listeners now, they are actually, they've gone to the dentist, and the dentist told them, hey, you've got 2 cavities, but they had no pain. They had no pain. Would they go to that dentist and go, doc, I'm not feeling any pain right now, so can I just wait until it becomes so terrible that I have to come in for a root canal? Well, of course not. They would actually say, no, feel it now. I don't want to feel the pain, So I always say, let's get checked. That's what I want. I want everybody to get checked, because 9 times out of 10, we are going to find a misalignment at this area that may not be giving you any symptoms. But number one, brain fog isn't normal. Not sleeping at night isn't normal. Headaches are not normal. I mean, I have patients all the time that say, you know what? I have some headaches, but no more than normal. I'm like, they're not normal. They're not normal. Migraines are not normal. There are all sorts of things that can actually occur due to an atlas misalignment that you may not be putting those things 2 and 2 together. It could be a simple mechanical issue that is not allowing you to live your best life. And the only practitioner that can actually figure that out is an upper cervical chiropractor.